Good morning. Spinecor and exercises have both results that testify their efficacy in AIS treatment. The aim of this study is to compare end-of-treatment results in Spinecor versus AIS exercises. It is a prospective control study. Inclusion criteria were from a prospective database all patients who did their first visit in 2008 to 2009 and began AIS exercises or Spinecor therapy. With diagnosis of AIS, more than 15 COP degrees, and research 0 to 3. In our protocol, as Fabio said, we prescribe AIS exercises up to 20-25 COP degrees, Spinecor up to 30 COP degrees, and rigid brace with more than 30 COP degrees. Our population was in this exercise group 107 patients, and in Spinecor group 112 patients. We examined end-of-treatment patients, patients who ended treatment within October 2012, and worsened patients who changed therapy. The population was of 41 patients in the Spinecor group, and they were Spinecor 20 hours a day. And in AIS exercise group, there were 28 patients, and they did exercises, AIS exercises for 45 minutes, 2 times a week. In Spinecor group, age was 13, COP was 24, and while in exercise group, age was 13, and COP was 18. We did a clinical and an X-ray evaluation, both at start of treatment and end of treatment, or in patients who worsened when they worsened of more than 5 COP degrees. Main outcome measures were COP angle, trace, and the ATR. The results. COP degrees in Spinecor group were significantly larger than in AIS exercise group. Here you see the results. You see in green on the top the dropout, patients still in treatment, worsened, stable, and light green, the improved ones. The difference between the two groups was not significant. Aesthetic changes were in both groups good changes, while there was even here no statistically significant difference. Most patients were stable, or many of them improved. Interpretation obviously must be cautious, since in Spinecor group COP degrees were significantly larger. In terms of risk of progression, anyway, results were slightly better in Spinecor group. Both treatment achieved some aesthetic improvement and similar efficacy in preventing progression in trace and ATR. Since in Spinecor group patients had higher COP degrees, so higher risk of progression, results were similar, so Spinecor seems to confirm its major efficacy versus exercises. What happened to patients who worsened? In the exercise group, patients who worsened were 92% research 0-1, and they passed to Spinecor or to a rigid brace. Then we observed them till April 2013, and 69% of them were stable or improved, 23% dropped out, and only one patient had more than 30 COP degrees. He's still in treatment. with 36 cup degrees and RISER 3. As to Spinecor group, 93% of the worsened patients had RISER 0 to 1, and a rigid brace was prescribed. With rigid brace, 73% of these patients were stable or improved, 20% dropped out. One patient worsened, is still in treatment, and he has 38 cup degrees, RISER 2. The limits of the study are that population were quite different, small, and anyway, it's a preliminary study. We will follow with this study. And the stance is that it shows that varying therapy according to results reduces invasivity and promotes good results. We have some doubts about the dropouts in this group. Thank you.